Welcome to Real Business Lifetime Lessons, where Carolina business leaders get real about growth, grit, and leadership. Today, we're bringing you a special edition called White Coat Conversations, where I sit down with healthcare and wellness leaders making an impact across the Carolinas. I'm your host, Josh Busbey with Lifetime Insurance Agency. My guest today is Patrick Zeoli, a registered dietitian, founder of Zeoli Family Nutrition Consulting, and a passionate advocate for helping people achieve their health goals. With a master's in public health and experience across sports nutrition, clinical care, and private practice, Patrick now runs his own consulting business serving clients throughout North and South Carolina. He believes in building trust, accountability, and long-term change, helping clients not just improve their diet, but transform their lives. Patrick, thank you so much for being on the very first episode of White Coat Conversations. Pleasure to have you.
Thank you. Yeah, thanks for having me. It's a cool
Yeah.
experience. It's a good thing to talk about. I appreciate you giving me the opportunity to chat about it, and I'm looking forward to it.
Absolutely. As we chatted before, nutrition is definitely a big part of my life. It definitely changed my life as far as when I start my fitness journey. And it's cool to talk to some more about this with not only a professional, um, just to get your insight on everything, your background and your journey for our listeners. All right. So Patrick, what first drew you into the world of nutrition and health? Was there a defining moment where you knew this was the right path for you?
Yeah, so I've always kind of, when I was going through high school and into college and stuff, I always knew I wanted to be in like a sciencey type field. I never had much desire to do, I don't know, any math or business type stuff or anything like that.
Right.
And back then, growing up, I would say there was no singular moment or anything that was like, you're going to be a dietitian. I didn't tell people growing up I was going to be a dietitian. I probably always told people I was going to be a chef. I guess that's kind of where I started with it, but with the food employment kind of goals in my
Mhm.
life. But as I kind of got older, I knew science was something that I really enjoyed, but I also really did like being in service of others. So I felt healthcare was probably a good route for me to go. And I just kind of naturally fell into nutrition based on like the schools I was looking at, but also just my love of sports and seeing how plays a role in everything you do and from an athletic perspective and things like that. So ended up working out that I went to school for it. Went to school I had the school I had opportunities to play golf at had nutrition and things like that too. So it just was probably a little bit of divine intervention in me going the route I was going and things and just things kind of lining up that way. So I ended up going undergrad for it and then really falling in love with it there and seeing how I could pursue it as a career as a dietitian and then doing a grad program in public health to really kind of get the full scope of being a good practitioner. I felt understanding why people might be sick or going through what they're going through based on how their environment plays a role in their health and things like that. And it's all kind of led to I would say what is my kind of therapy style nowadays. And so, yeah, I would say I didn't necessarily have, one moment or anything like that that got me there. It's probably been a cluster of different opportunities and just saying yes to things and learning as I go. But I do really love it now and love it enough, obviously, to start my own practice and stuff. So it's been very, very good. And
Absolutely.
I've liked it a lot.
Yeah, absolutely. Kind of a similar journey. I did culinary arts in high school, and I always wanted to be a chef. Found out that, I enjoy it more as a hobby and I went through a various changing careers until I finally found my niche of, helping individuals all over the state of North and South Carolina with insurance and building relationships and doing whatever it takes to make sure that they get the insurance that they deserve, and also give them that peace of mind. So I can definitely relate when it comes to that.
You weren't craving the long hours of being a chef or doing anything like that.
No,
I hear
and
you.
I had big dreams, man, to open up my own franchise of Italian restaurants. It just, but that's part of growing up, and things change, and you end up finding your true calling and everything like that. And me, it's helping people. So just
Yeah.
like you.
Yeah, I hear that.
Yeah. So kind of in addition to that, you've mentioned you always love cooking. How does that early passion show up in your work today?
Well, I would say, I mean, obviously, if you love cooking, you love food in a sense, and
Hmm.
I would say it helps me kind of understand how for one, how like emotionally tied people can be to food. Obviously, someone who like loves food or grew up cooking with my mom or doing things like that, like you understand that food is much more, and eating it in general is much more than just like what you choose to eat or how much you eat and all that kind of stuff. Like there is genuine emotion and feelings tied to a lot of the things we eat or cook. So I think it helps me get a feel for that. On top of that, a big thing I talk about with pretty much every single one of my clients is how to like prepare foods properly, like how to meal prep, all those types of things. And if I had no kind of understanding of like what it meant to actually cook foods and prepare foods or go grocery shopping for foods, I don't think I could give very good um, counseling advice in that department. So
Hmm.
I feel like it definitely plays a role. Like there's people like technically what I provide is called medical nutrition therapy. Like a lot of times it is involved with like managing of a disease or doing something like that, like helping somebody with diabetes or even with like IBS or things like that. But you can't really talk about managing those things without talking to people about how they prepare the foods that they eat every day. Yeah, so whether
Hmm.
that's like teaching somebody how to use a crock pot or like educating on what something should be, you know, cooked to in terms of temperature, like I feel like it helps to know that. I think a lot of dietitians probably fall into that camp that we all like to cook in some capacity. We have to go through food labs in college and stuff, so like that's obviously part of the but it definitely helps that I feel like I enjoy it because I like when it comes to like coming up with recipes or things that people want to eat and stuff, it's easier for me. So like I like to think I can make meal plans and stuff that aren't boring or
Right.
they're actually if I would like to eat it, I'm pretty confident somebody else would like to eat it. So that's very helpful, I feel like. And I think a lot of my clients would probably I hope would agree that it's nice to know that like what I'm telling them is actually like easy to put into practice because I'm someone who can do it. Like I'm not like somebody who's a chef,
Hmm.
but I'm just somebody who likes to be around the kitchen. And if I can do it, they can probably do it also. So
I
definitely,
gotcha.
I mean, I talked to pretty much every single client about like what their skill level is in the kitchen and then trying to meet them where they're at and help them grow in that so they can at least feel like they can provide for themselves, maybe cook more for their families, stuff like that. So
Hmm.
it's definitely involved. Not as much as you might think, but it's definitely involved.
Okay. Is it more so when it comes to nutrition with a client? Is it more so not knowing what individual, like the meal process part of it, what should be in that, or the level of cooking ability?
I would say it varies. Like I've had people come to me as a client who I would say is they're probably like better home cooks than I am. Like they definitely like know their way around and or feel like they're very comfortable in the kitchen, whether they're like a mom who's cooked for a family for years or just somebody who like loves to cook. So you get those people for sure. And then so with them, it's really about understanding like what to put on the plate. Like they have a good feel for like, how to actually prepare food, but they really have maybe they have no idea how much what a plate should look like that's conducive to their actual needs. For example, if somebody's got a calorie goal, how much should be on that plate to meet that calorie goal at any given meal? So something like that. But then I've worked with plenty of young men, for example, who couldn't tell you how to boil water hardly, so like that you obviously have a bigger educational component there. I like to frame I don't mind working with people like that. I kind of like it too because you get them to understand that eating and cooking is like truly a life skill. Obviously, it's like something
Hmm.
that you practice every single day, and if you can't do it at least in some simple capacity, you do put
Yeah.
yourself in a difficult spot from a health perspective. So it definitely matters, and I get the full range of spectrum on skill levels, I'd say.
Hmm.
Most people, regardless of skill level, I'm working with them on what they should be eating. That's the big part of it,
Right.
obviously. The majority of it.
Yeah.
Cooking always plays a role for sure.
Yeah. Yeah, for me, I absolutely love cooking, but it's so hard to find that motivation when it's just you. I find more motivation to cook for other people rather than just myself. I mean, I still do it, but it's always a struggle when it comes to getting that motivation to be like, "Oh, I'm gonna meal prep for the week," and not be like, "I have to do this," it's part of my routine.
For sure. For sure. I will say that is probably that is a common challenge. Like anybody who's a single person or even two people in a household, most recipes are geared towards more than one or two people. So you do have to adapt there. The fact that you find some motivation to do it is better than no motivation at all. If you can do it for a couple meals, is always better than no meals. So yeah, but
Absolutely.
I've heard that one for sure. Because you go to the grocery store, you buy you buy a pack of chicken. You're like, well, this is definitely multiple meals here, which is good. That's not a bad thing, but you have to be okay with chicken for multiple meals.
Yeah,
But
and it beats it
that's
beats eating out and spending a buttload of money as well,
exactly.
and most of the
Yeah, no,
time
absolutely.
getting not the right thing that you should be putting in your body if you are trying to, uh, diet and everything like that.
Yeah, absolutely. Absolutely.
Yeah. Let's see. How did your time as a student athlete shape your perspective on health and performance?
I would say like I've always been a sports guy. Like I grew up like I played like club like I was in AAU basketball all through high school, played football, like played a lot of intense sports. So like I've always loved sports. I ended up playing golf in college, which is probably like the least intense sport you could ever play. So I would say like a lot of people, a lot, maybe not even think of the nutritional component in that. I would say it helped me a lot to learn because it did end up helping me a lot because when I was in school at the time for it, and so like I started to easily draw the connections. But even before that, golf, while not necessarily physically strenuous, it's very mentally strenuous, and tournaments and things are much longer than any other sport you deal with. College tournaments, you easily could be playing around that's like close to 6 hours long, and so that's not maybe physically demanding, but it's so mentally exhausting. And not to mention you're outside and stuff. So I definitely learned the basic things, how hydration and stuff plays a big role. I even started learning that through high school because I would struggle with it. I'd get dehydrated and I'd be headachy, lack of focus, and you could see it in your performance. Last six holes, terrible, stuff like that.
Mhm.
But in college, I started to really get a feel for it, and I could see how I would come out of I would come out of the tournaments feeling way better mentally and stuff than guys on my team who just were running through the tournament on nothing but like a Red Bull and a Gatorade. It's like, you could see a difference, and then, I had a lot of friends that played soccer, and if they were not doing the right stuff, they really couldn't even get through the games. So, it definitely forces you to I would say college athletics especially, you start to see people you see very quickly who doesn't take care of themselves physically because there's it gets brought to light very quickly because of the intensity of the practices of the games and stuff like that. So I definitely saw it a bit in my undergrad and being an athlete myself. I really saw that in grad school when I was working with UNC Charlotte's football team and
Mm.
the basketball team.
Yeah. I mean, it's just as important to take care of the off the field stuff, as opposed to on the field stuff. I mean, you gotta take care of your body and, and recovery and all that.
Yeah, I mean, absolutely. Like skills matter. Like it's not just because I eat fruits and vegetables, I'm going to be a better basketball player than you. Obviously, skills matter. But when you're at a level like that where everybody is incredibly highly skilled, you need to do what you need to do to make sure you're getting ahead or, keeping up and not falling behind at least. And
Yeah.
the nutrition plays a big role in that. The young guys tend to get baptized by fire a little bit in those first couple of practices and first couple of months of working out and stuff because
Mhm.
they don't really quite know how to take care of themselves yet.
Yeah. I mean, just like the recovery that, let's say like a Derrick Henry or LeBron James, how much time and money they put into that. I mean, of course, they're much older and professional and everything like that. But just reading up on the amount of recovery and everything and all the different things that they do is just incredible. And I mean, you got to do that, especially the older you get in your prime and afterward. You made the leap from private practice to starting your own business earlier this year. Congratulations, by the way. That's a heck of a
Thank
milestone
you.
and accomplishment. What gave you that confidence to take that step?
I would say I don't know, but my And I'd say my family mostly, but I would say my parents and my wife mostly, they were the ones who were like, who I guess saw that I was capable of doing it and just said now's as good a time as ever to do it. Uh, I think, yeah, so I started it back in February of 2024. Uh, so
Hmm.
like got a little bit over a year and a half into it now. And I think starting out, I think it was just that I had felt like I had learned enough in my current job to kind of replicate it in a fashion that I felt like I could sustain. And so I would say that's where the confidence came from. I had no real private practice experience until the job I was working, the group practice I was working for. So I didn't even really know what it looked like. If I had known in college what really went into it, I might have started it earlier. But getting on the job kind of experience to at least see what the ins and outs look like, what kind of selling looked like. I'd never had to sell anything.
Right.
Not that I super have to sell anything. You still have a service and a product to sell. So being able to market myself and stuff like that, in that, I would say doing that in the group practice I worked for gave me some confidence to at least feel like I wasn't going in completely ignorant and blind to what I needed to do.
Hmm.
But yeah, it was I would say most of the confidence definitely came from probably my mom saying, "What are you waiting for?"
Yeah. Yeah.
It's been good. It's been a big there's been a fair bit of a learning curve for me that I still, growing a business, keeping
Hmm.
track of all the finances and all that kind of stuff. But I like that there's stuff that needs to learn. It's nice to know that
Yeah.
I have control in the success of it, but I also have to learn a lot to keep it going the way I'd like to see it go.
Yeah. It's just like one of those cheesy sayings that just because you get behind the wheel of a car doesn't mean it's going to drive itself.
Yeah, that's true.
Yeah.
That is true. Exactly. You really have to ask questions to people who are willing to help you, but I think you probably have to be willing to mess things up and keep giving it a go afterwards. So
Absolutely.
I'm sure there's plenty of things I'm going to screw up down the line, and hopefully you just keep kind of snowballing
Hmm.
those into a better product, a better
Yeah. Yeah.
overall business and things. So that's kind of the mentality I've had with it over the 18 month is not that like expectations are low, but just like trusting that if you keep doing decent stuff that seems to be conducive to a successful business, that will keep growing and growing and growing.
If you could go back and give day one Patrick one piece of advice before starting your business, what would it be?
I think myself inherently, I'm like not a good question asker. Uh, I'm or like even an ask for help type person. I'm like a
Hmm.
very I'll just figure it out kind of guy,
Yeah. Yeah.
which is not great. I mean, sometimes I like to think it's good because you make a decision for yourself and you keep it moving.
Hmm.
You can't really do that when you don't necessarily have any idea what's going on. Like you can, like
Yeah.
I think if I could tell myself back in February of last year, just ask questions. Like the worst things people could say is that you're doing it wrong or they might not answer
Right.
you. And so like I've been trying to be better about that. That definitely huge work in progress. But I think that would be my best advice, probably to anybody starting in business, unless you're an expert who's done it before. But even that type of person, you probably still should be game to ask questions because I definitely don't even know everything about nutrition. So I definitely don't know everything about business, so
Yeah.
you have to ask questions about and be willing to learn stuff and be humble enough to know that you don't know something, I think is very handy.
Yeah. No, absolutely. It's especially if you're the type of person that never settles and always wants to put the absolute best effort you can into whatever you do day to day, whether it's professional or personal life. You always need to be willing to, one, take criticism and whether it's new ways you go about doing things or from your mistakes or everything like that, because everything that leads up to where you are today makes you who you are.
Yeah, I would agree. There's no way to know everything. And if you don't keep trying to find new things or ask people questions, I feel like there's no growth in that. Yeah, you just try to you always tell yourself like, "Oh, I just figured out you don't wanna bother somebody," but, like I said, the worst they could say is no or give you no help at all, and if they did, then you're no worse off, so,
Absolutely.
but yeah, that would be what I myself from back then. Just keep asking questions.
What's one of the most rewarding transformations you've seen a client go through?
I would say there's been a few, and I would say most. So I would say most of the people I end up working with are like weight management, like they're trying to lose some weight and they're trying to lose weight in some capacity. So I'd say a lot of
Mhm.
the biggest, like most meaningful things I've seen are people like that who have tried to lose a bunch of weight. There's one guy I met with last week. I would say he's probably up there. Uh, he's lost like 70 pounds since the last
Incredible.
year, basically. Yeah. So we really, really incredible. And I would say he's up on that list because in the past he had been he had been like heavy his whole life and he had been part of some research studies that had gotten him to lose weight super fast, which he was happy with, but he had gained it back. And that's when he ended up coming to me. And this time
Mhm.
he's done it very slowly and sustainably. So he feels like I think that's rewarding to me. One, because now he just actually became a dad. And so he feels like he's in a healthier spot going into being a dad. But yeah, that one was good. And then I've had another guy who I've worked with. He's been one of my longest clients, and he had lost a bunch of weight before he'd even started with me. It's like started at a super, super, super high weight. But since starting with me, has lost like another 150 pounds.
Yeah.
He made a comment once. He said something along the lines of he plans for things now, looks ahead
Mhm.
and plans for things. Whereas even before he started with me when he was at his heaviest, he never planned ahead because he was
Mhm.
just very low on life. Didn't know
Yeah.
what,
Motivation,
I mean, at
lack of
that stage of the
motivation.
game, like yeah, but even from a health perspective, like you never quite know what's going to happen when you are that heavy and scary, but it's just a fact. And so I think he had relegated himself to the fact that he might not be alive for like super long and he has a new
Mhm.
outlook on life. And to me, that feels like he's someone who is, I've helped them gain their quality of life back, obviously. Those, those would probably be the most rewarding ones.
Yeah. And, don't discredit yourself either. You're also doing this for the satisfaction and excitement that, not only are you doing your job, but you're also making a difference in people's lives and giving them that sense of there is a light at the end of the tunnel. Of course, I got to work and everything to get there, but I don't have to give up hope.
Yeah, that's right. Exactly.
Absolutely. With so much noise online around diets and quick fixes, how do you cut through the clutter to build trust with your clients?
Yeah, I mean, that's definitely a big one. I probably actually
Mhm.
talk about that in every initial consultation that I have. Like, if usually I'll ask people if they've tried something, if they've had some success with certain things, or if there's anything, if at any point, whenever I'm working with them, if they ever see anything that's trending that they want to try or whatever they think is good, let me know and we can discern it. I try to build that trust in the sense that, legally speaking, I'm supposed to be an expert on nutrition. And I'd like to think I have more knowledge than the personal trainer you found on Instagram or you just maybe the random person on Instagram who calls themselves a nutritionist. Like anybody could really call themselves that, but not everybody can call themselves a registered dietitian. So I try to say there is a people have asked me like what's the difference and stuff, and I tell them, the board certification, the license, the hours, all that kind of stuff, the degrees. Um, but to build the trust, you have to show them the evidence, I guess you would say. So anytime somebody brings something to me like a diet trend that they found, or like, what do I think of this supplement? I give them an honest answer. Like, I'll try to always give them an honest answer, but I'll always try to give them like a why. I'm not just going to say, oh, I think that's stupid because or not useful
Right.
because that's the person who is endorsing it. There's a potential that somebody who just likes a supplement on Instagram is actually supporting a good supplement. It might be more likely that they aren't, but it's possible. So I'm not just going to right away tell them that no, don't listen to anything you see on social media. I think we all have a responsibility to look at things and discern them. And
Mhm.
so if it's something that I definitely I have heard of, like I will kind of give them the rundown and usually like the research behind it if I can off the top of my head or experience, that I've used evidence based practices that I've used with clients before and why what
Mhm.
they're showing me might be in support of that or not conducive to that. I'd be lying if I said I knew everything that was trending on social media. There's so much garbage and so much just volume of stuff on social media that people see in the health and wellness space that I can't really ever keep up with all of it. I try to be in the know at least a little bit. But the biggest thing I would say that is helpful and I like to think builds trust with most of my clients is that if they bring me something, I am totally fine saying I will get back to you on that. Like I've never heard, like admittedly, I have never heard of the supplement. Let me see if I can find some studies on it and we can go from there. And you maybe just didn't know it and you've never been able to put it to practice and now I'm helping you put it into practice. So yeah, that's a big one. It's a big one nowadays because you see so much trash, but that's a big thing. Yeah.
I got
It's
you.
amazing how many people I've had say all this on TikTok. What do you think? And I'm like, I don't even have a TikTok. So we'll go through figure this out together.
Absolutely. Absolutely. Let's talk about community vision a little bit. What role do you see nutrition counseling playing in improving community health in the Carolinas?
Well, I hope a big role. I would say it probably has a ways to go. Like I would think the biggest role I could see nutrition counseling playing a role and medical nutrition therapy playing a role is that if um, more and more doctors' offices and even hospital systems start employing or like being more connected with businesses like mine or even just building more outpatient nutrition counseling settings. I think
Hmm.
that would go a long way. I think more awareness on the fact that people can use nutrition counseling people can use their insurance for nutrition counseling. A
Hmm.
lot of times, most of the big providers, Blue Cross, United, Aetna, those they have nutrition counseling covered under your preventative benefit. Even
Yeah.
Medicare and Medicaid have some coverage for it as well. So that I would say is a huge thing. People actually knowing that they can use it. Not every dietitian accepts insurance. I'm unwilling to go through that kind of, I don't
Yeah.
know, gauntlet,
Jump
but
through
it
those
is
hoops.
I would say it's a good thing. People know that. I think that would go a long way because probably there's a lot of people who are like, I might meet with a dietitian, but I don't want to pay money to do it. Um, and so that would be hugely helpful. And then I think what's going on nowadays with just like health advocacy becoming more of a mainstream topic. I think it helps to have dietitians get out and say things. Have opportunities to talk on podcasts with even industries maybe they aren't a part of or doing news segments, asserting themselves as legitimate professionals in the space and not just being there's a lot of people who will like accuse dietitians of being paid off by certain things. You're paid off by big seed oil or big corn or big sugar or whatever. And it's like, okay,
Yeah.
most of us are not. And most of us just try to give you the honest truth. And I think that's an important thing, but I think it definitely starts with where the healthcare system is, and so most people, know a doctor or go to the doctor, and if the doctor is telling them that they need to make a change in their life, but not giving them the time to support that change or like the resources to support that change, then most people aren't going to make those changes. So like if more and more dietitians are available to service primary care physicians, even hospital outpatient settings, all that kind of stuff, and more people are aware that they can use their insurance to work with the dietitian, I would say that's where you actually see the improvements on community health getting us more having people be more aware that they can actually use services like mine or even in the outpatient setting of a hospital or something like that, I think is very handy. Would go a long way. I'd like to think at least.
Absolutely. All right. Zeoli Family Nutrition Consulting. What's your long-term vision for it? Do you see yourself staying solo or building a team down the road?
I think I'd like to build a team down the road. Part of it actually, the name was my little sister is actually studying nutrition as well. So I named it that. If you ever wanted to join me, just down the line. That was at least in the background. The big reason why the name is because I want people to know exactly what I do. That is what you get when you come work with me. Like I could have named it something, trendy and food related, but somebody might have to guess then what we do. I wanted them to know what we do. I think I'd like to have a team just because then I might be able to service different specialties, whether that's disordered eating or like specifically diabetes or things like that. That would be cool. I would also, I think down the line, I hope to be able to do that just because I think that selfishly that would prove to myself that I can grow the business, that I've learned enough to grow the
Yeah.
business. Unselfishly, that would help us reach more people, more dietitians. helps you reach more people. So um, that would be cool. I think I would like to do that. I guess that's the 5-year plan, I suppose. But I don't necessarily mind being a solo practitioner at the time. Right now, it's very cool, and it's let me work through it and kind of learn at my own pace. And obviously I like it, but I have been part of teams my whole life in terms of sports and even in the jobs I had in college. Being on a team is very cool, and to think that I might be able to form one through something that I built that's definitely a legitimate goal of mine.
So we haven't touched on outside of nutrition. What are some passions and hobbies you were doing to keep yourself recharged?
Well, I would say first, I do love going to church. That's my thing. I would say that's what grounds me and my faith, and my family's all, very involved in their faith. I do find a lot of peace and fulfillment in that. My wife and I love our faith and being practicing Catholics. That is probably the first thing. Um, and then from a activity standpoint, I love to golf. A perfect day for me doing something active is getting to play golf. That's it for me. Like I'm not like I don't have any like super crazy interests. I love being outside. I love playing golf, and I love like spending time with my family. Like very simple. So those are the things for me. I played college golf since COVID and graduating. I never really got back into like tournament golf. Going into next year, that's my goal a little bit, is to get back into tournament golf a little bit, just
Okay.
to kind of get competing as well. But I also coach basketball, and so that's my other activity of choice, where I feel like I can give some the time, talent, and treasure kind of deal. I feel like I give some time back to the community doing that. So I coach at a middle school, and then I coach an AAU team in the summer times, or at least I did this past summer. That's kind of what I do. They get away from doing work, but um, yeah, I mean, it's those are my big things for sure.
Absolutely. Yeah, I'm sure your golfing buddies probably are excited that you want to get back into more tournament golf because you probably mop the floor with them when you all play together.
Well, I'd say I play mostly with my younger sister, and she actually plays Division 1 golf. So like I just get beat up all the
Oh,
time.
okay. So it runs in the family for sure.
Yes, yeah. It doesn't matter what tees she plays from, she'll beat me. She's very good, and I'm very proud of her.
Absolutely. All right. So looking back at your journey so far, what's one lesson you've learned that you think every business owner or healthcare professional should hear? Hit you with the good questions.
Yeah, yeah, yeah. That is a good one. I would say, regardless of what you do, people, and I'm sure you've heard this, like people will like patronize or buy from or use like services and products from people that they actually like a little bit. I think that might you might not necessarily even have the best nutrition counseling services or best meal plans or whatever. But if I've been able to make positive connection with person and they believe that I can actually help them, they're more likely to use my services. So I think if I would say more healthcare professionals need to understand that the public wants to trust us, and we owe it to them to be personable and also understanding of what they go through. Because nowadays, like everybody, I feel like since COVID, there's a large distrust of healthcare, and probably rightfully so in a lot of ways. But people still need help, and they still want help. And so I think as a dietitian, I've always felt like I owe it to that person to try to understand what they're going through. And I think most healthcare providers would benefit from being a little more conversational and friendly and welcoming and understanding of people, and not just saying this is what's going on, this is what you need to do. Making a legitimate connection with people probably goes a long way. It probably translates into other businesses as well, but speaking for
Hmm.
healthcare providers, I think if you can build some sort of camaraderie and trust with people, it goes miles, I think, in terms of being able to help them get healthier. Um, so but healthcare is a very vulnerable thing for people, and if you're not understanding and welcoming, I don't think it's going to go super well. And you're not going to get the best. You're not going to be able to get the best out of that person, I would say.
Yeah, absolutely. It definitely translates into what I do as an insurance agent as well, because if you sound like a salesman, you're not going to develop relationships. You're not going to get business. People appreciate that I treat them like a normal person because at the end of the day, yes, I'm in sales, but I'm a normal human being looking to help people. Clients of mine appreciate making it personable and communicating and everything like that, and just building relationships, being honest with the client. That's another one. That's another thing that they love. I love giving my clients the straight, blunt truth. And I'm not going to BS them on something just to get a sale out of it. I'm going to do whatever's necessary or in my power to make sure that that client gets the services that they deserve.
Yeah. I mean, you owe it people to be real, to them to be honest. And I think people pick up on that very quickly if you're just trying to sell them what you expect you want to sell them. For me, I think in that first conversation I have with people, I need them to see that they can actually achieve what they're trying to achieve. And if I can't get them to understand that or feel like they believe, then it's going to be difficult. And that's not just me forcing a meal plan on somebody or telling them that like, just because you've tried everything, you have to be understanding of what they're going through. And you have to try to make that legitimate connection. And the same, like you said, same thing. Nobody's going to want to buy an insurance policy or anything like that if they just feel like all you care about is selling it to them. I agree 100%.
Yeah. And also, you got to be able to listen. 80% of my job is probably listening because at the end of the day, you need to listen and find out not only what the problem is, but where they're coming from. And then, of course, listening develops trust, and that's how you build a relationship. Because to me, it's not a transaction. I want a client. I want someone that will last a long time and we have a great relationship rather than just, getting a quick sale.
Yeah, I agree. I
Yeah.
agree for sure. Like you gotta be honest with people. And if yeah, if you can't do that, then you're not going to be very successful in any business, I don't think. And if you're probably definitely not going to be successful as a healthcare provider, in my opinion.
Yeah. If someone listening today wanted to take that first step toward better nutrition or healthier living, what's a simple, practical piece of advice you'd give them?
One thing that everybody probably, okay, so the typical American diet is 60% carbohydrates. Yeah, so, breads, processed foods, snacks, pastas, all those types of things. You definitely need carbohydrates in your diet. I would say most Americans probably would make a positive impact in their diet if they thought about the protein source that was going on their plate first before anything else, where that is coming from. I mean, in my experience, generally, if people eat more protein in a daily basis, they tend to have better control over their weight overall. So I would say that would be probably my first little bit of advice is try to maximize your protein intake or at least increase it from what you're currently doing and then meet with a dietitian for real. That's not
Yeah.
even being a joke. Like it's hard to discern how much you need to eat or what to eat. And so dietitians are literally trained in doing that. And there's plenty of great ones out there. And, um, they can be very, very helpful.
Absolutely. Where can people connect with you, learn more about your work, or reach out if they'd like your help?
Yeah, I would say the easiest way is to visit my website, and that's just my last name, Zeoli, Zeoli, and then nutrition.com. And all the info's there. You can make an appointment there. You can book straight through my website if you want. You could also reach out to me on Facebook. It's Zeoli Family Nutrition Consulting, Facebook, on Facebook. And then I do also have an Instagram that's PatZRD. That is my Instagram. So those are the best ways. I would say my website's probably the number one. All my contact information's on there, email, call. You can fill out forms on the website if you want, but email and phone call are all on there as well. So yeah, that would be the best way. You might be able to actually find me through your insurance if you've got an insurance and you like to look up providers that way. If you have Blue Cross, Aetna, United, you should be able to find me, or MedCost, I suppose, as well. That's a small one, but some people have it. But yeah, those are the best ways. My website probably the number one though.
Awesome. Well, great stuff, Patrick. Thank you so much for taking time to talk with me a little bit about nutrition, and you're passionate about it, but it was great to talk to you about not only the business side of it, but also personal side of it and everything as well.
Absolutely. I appreciate the opportunity. I think it's a good little concept for a podcast. I think there's probably a lot of providers in these two states, North and South Carolina, that have a lot to say about the health of communities. So I hope it goes well for you. You got some good positive guests and stuff lined up. So I'm happy to be one of the first few in the rotation. But hopefully it gets big enough where you can have me on again for a different one.
To our listeners out there, I hope that another reason why I'm doing this podcast series is, to connect with people and send a message that if you are struggling with, nutrition, just don't give up. There's always a light at the end of the tunnel. And, people out there like Patrick are more than excited to help and make a difference in people's lives. So just don't give up and just know that there are people out there to help.
Yeah, for sure. For sure.
Well, thank you so much for taking time to listen to the special edition of Real Business Lifetime Lessons called White Coat Conversations, where I'm your host, Josh Busbey, and I sit down with healthcare professionals to talk about the professional and also the personal side of healthcare and medicine. Have a great day.